That's really cool.
Hmm.
All right, everyone, welcome to episode 158.
Wow.
Yeah, of Random Musings from the Clinical Trials Guru. I'm sick, but we do these episodes whether I'm healthy or sick, manic or depressed. Usually I'm manic. We've got Monica. Monica came back from an investigator meeting.
Yes.
Global clinical trials where we are sitting is going to get very busy in the second half of this year.
Yes.
With the study starting immediately.
We
When are we screening?
Super busy now. We are start screening on June 12th. Right after
Wow. So right now it's June 7th, and so June 12th. Okay, good. So next week we start screening.
Yeah.
We've got tons of people ready to go. I'll get some. You have people lined up? Okay, I get some too. I didn't realize it was that soon.
Yeah. I'm
Get
going to call
patience for this study.
The study.
So,
For beep.
yeah. Good. So this podcast will be about investigator meetings?
Yes.
It was your idea to do it.
Yes.
Very good idea.
Yeah.
I just wanted to do any podcast today, so this was a good one. So we've done it before, but we haven't done one on investigator meetings in a long time. And before investigator meetings, do you know what it's called when the CRO and sponsor do their own mini meeting prior to the sites coming?
No.
It's called a kickoff meeting.
Oh.
KOM. It's for CRO and sponsors only for that study. So all the CRAs, like everyone from the CRO and sponsor that's involved, will have their own meeting. Usually it's if they do a physical meeting like yours,
Yeah.
the day before or 2 days before, it depends, 1 or 2 days prior to the sites arriving, the CRO and sponsor have their meeting. And then they prepare, they talk about the monitoring plan, different things that they don't want the sites there for.
So the CRAs have the privilege to be part of both.
Yeah, and they're probably like the new CRAs are taught, to go introduce themselves to the sites. Like yours, you said we have a very nice one.
Yes, we had a
That's
very
good.
nice meeting with our CRA, and she is amazing. She's quite nice.
My only question, did you get me, well, you networked with all the sites, and we'll talk about the importance of networking. Did you get me any new subscribers?
I will.
Did you?
I'm talking with one of the...
Oh, you are?
Yeah.
Okay.
So.
Good. That's bonus. You don't need to, but that's great. Great idea. Tell them the podcast is fantastic. Yeah?
I actually told them that we do videos that I was doing in Spanish, and we spoke about your videos.
They had no idea, right?
One of them didn't, but one of the girls did.
Oh, really?
Yeah, she said
Okay.
that she mentioned that she had seen some of your videos.
Oh, did they recognize you?
No.
No?
No.
Okay. All right.
But they recognize your name.
And now we got Alexa, too.
Yeah.
She's listening. Okay, so what did you learn? This is not your first investigator
No.
meeting? Okay. So what happened? Like for those who have never gone, what can they expect?
To be working hard, because like right now the previous ones I have been were like quick, but this one was much quicker. They went to do, straight to the point, which is
What do you mean?
convenient for them. Like
There was no welcome dinner?
Yeah, we had,
They had
a
a welcome
welcome
dinner?
dinner, but the next day,
Was the food good?
yeah, quite good.
Dallas?
Yeah.
Was it in the airport?
No, it was
Oh.
actually in a hotel, 20 to 30 minutes.
Wow, okay.
Yeah. But this one was, so started at 7 a.m. That's when we start getting all the information.
The morning of the first day.
Yeah.
Yeah, they start early, but they do
7?
breakfast
Yes, we did breakfast.
at 7.
Yeah.
Yeah.
7 a.m., but everything was quick, like 30
Yeah.
minutes breakfast.
And when those are on the East Coast and we're a California site, like what they do 7 a.m. on the East Coast, when you're from California, it's 4 in the
Exactly,
morning.
It's 4 in the morning. No, not even. Yeah, that's what I had.
And you gotta wake up.
I woke up at 4 in the morning to get ready.
Yeah.
So we start at 5 a.m. for us.
Yeah.
So, I mean, it's like I say, it's nice and it's obviously it's convenient for them and budgeting and everything. But it would be nicer if they split this into days so that way you get the information. I mean, you get that.
Yeah, this was a short one.
Yeah,
so
but we did everything in one day. Like everything. I mean, like we had the breakfast, then the training, then like a 10 minutes break, then keep going, then another like the lunch was 20 minutes.
Really?
Really. So 20 minutes lunch.
20-minute lunch?
Yeah.
Wow.
Then we continue, and then we had like a small break, continue, and then run to the airport. So like we
So the
didn't
day
even-
of the meeting you left?
Yeah.
Wow. Usually it's not that rushed. Usually it's like 2 days.
Yeah.
You arrive the day before for the welcome dinner. Then the last day is like half day, and then let everyone leave.
So I think the CROs are trying to cut budget in this kind of stuff, but I don't see the point because if they want the people to be trained properly, and it shouldn't be
Wow.
that rush. Like
It was rushed.
yeah, and because because all day is just like non-stop. In some point you get tired and you don't even understand properly everything is being told, So it wasn't very nice.
So what did you...
But-
Okay, so you think it was important to go?
Yes.
'Cause
Oh, definitely.
Sometimes PIs don't go. How many sites were there?
Wow. Only from California, I heard, from Southern California, I heard there were 25 sites.
So this was a huge study.
Yeah. Yeah, it was a big study.
Like,
Mhm.
how many people were there in the whole meeting?
I will say, wow, I saw a lot of people. At least 30, 40 tables, and each table had average of 6 people.
Wow. That's pretty big.
And I saw a lot of doctors
So like
this
150,
time.
150 people. So maybe 2 people per site.
I think I'm more than that. And I saw a lot of doctors this time.
Yeah.
Last time I went, I saw doctors, but this one was, the amount of doctors that I saw in this study were more.
Yeah. Usually they don't go.
No,
PIs.
Just in my table,
Unless they're new or very experienced.
4 doctors and 2 study coordinators.
Wow. At your table.
Yeah.
And did you network with people?
Yes, I did.
And what
I did.
did you guys have breakout sessions where you talk about strategies, or they did everything in the meeting?
No, pretty much like I said, it was just training about it.
Training. Did they do
The
radar
protocol.
training?
They did.
They did. So they
Yes.
told the raiders go in this other room.
No, the same room.
Oh, so everyone
Everything
got
was
the
just
training.
yeah.
So you got radar training?
Yes, I did.
Did you pass?
Yeah, I don't know. I think so. I gave all my tests, so hopefully.
They didn't tell you there?
No,
You didn't have the remote to enter your answers?
no. It was actually paper, so it was old school.
Sometimes they have the remote and you
Yeah.
can see on the screen what
Uh-huh.
everyone picked.
No,
Ah,
No, we
okay.
didn't.
How many scales did they do training on?
they did train us in. It was like 1, 2, 3, 4, like 5.
Wow.
Rating skills, and then the rest you have to do it online.
So you got there the night before and you left the next day. Really?
Yeah, it was like
Less than
tiring.
24-hour turnaround.
Yeah.
Wow.
It was really tiring. I'm still catching up.
So the welcome dinner, were people like, did they have an open bar?
No, but they had a wine and champagne.
Oh, just for everybody?
Yeah.
Okay.
And beer.
Open bar?
Yeah. I'm not sure if it was open bar. I think so.
They just give you beer?
Yeah.
They walk around
whoever
and...
wants.
Wow,
Yeah,
that's cool.
Yeah, food was really nice.
Okay.
Why it was quite nice.
Yeah, I know at these things sometimes clinical researchers like to party. They
Yes.
like to get down.
People take it for granted. You know that I realized that that's why I like to go to these trainings, because you really learn about the protocol. You can ask questions.
Did you ask anything?
And yes, I did.
You did?
Yeah.
In front of everybody?
Yeah.
And you didn't say subscribe to the podcast? It could have been 300
Next time,
people that
I
we
will
get.
just raise my hand and say that.
That's it. And then
That's
sit
it.
down.
I'm not going to ask questions.
Would you?
Yeah,
No,
questions.
you wouldn't do
Just
that.
advertisement.
So you actually raised your hand and asked questions?
Yeah,
What
I
did
did.
you ask about recruitment?
No.
Oh?
No, I asked about one of the tests, one of the
Skills?
skills that we were.
You're going to be the rater, right? Not me?
Uh,
I'm a rater
maybe.
too?
I put you as a rater.
Oh, wow.
So,
Okay.
yeah, so.
And they're doing our SIV
Monday.
Monday. Good.
Mhm.
Then we're going to have Amy join. She's going to start now
Yes.
to help you out. Good. Anything else about investigator meetings?
I highly recommend people to assist to this, because that way you don't make as much mistakes. I know in research the room for mistakes is quite small, but if you go to the investigators meeting, you will learn much more and feel more comfortable doing the study.
Yeah.
So
What I like about investigator meeting is you can network with, people doing the same kind of studies as you, but they're in different parts of the country. So you can just network.
Yeah, not just and even if you have any question in the future, and you don't feel comfortable talking to the CRO, you can talk to your peers or people that were.
Or even like
sitting
talking
with you.
about budget, like how
Exactly.
much, there's this study coming out.
And getting ideas for whatever reason.
Yeah.
So, like for example, what are they doing for marketing, or how are they dealing with the patients, or if they have any issues, or you have any issues, you can share the information and see.
Yeah.
How are they managing? So I found it quite interesting, and it's a really good idea to assist to this. I mean, sometimes it gets in your schedule, whatever, but it's very good to assist.
Yeah, and our other site went there also.
Yes.
So Rosario was there, and she got Raiders trained also.
Yeah, everybody did.
Wow, good.
Yeah.
Good.
Everybody.
This is going to be a big study then. How many patients are they looking for?
750
Wow.
or 800. Yeah.
This is a
something like
huge study. This was
Yeah.
great. And only in Southern California alone, this shows you how
that.
competitive it is.
25 sites.
Just from Southern California.
Yes. But
That's
the
incredible.
CRA was telling me that is probably where the most, the largest amount of sites in the same area
Of course.
are. Yeah.
That's why it's so competitive here to get these CNS studies.
It is true, but
But
at
they
the
still
same
add
time,
25 sites.
Yeah, but then at the same time, is the area where they don't have as much as CRA concentration, so it's a shortage of CRAs, and then
Of course.
actually in every single area in the in the sites, staff too, so.
Wow. Yeah, I like networking, biz deving, sharing strategies about contracts. Meeting with the monitors is okay too. And lately when I've been going, it was more to... The last investigator meeting I went to was in San Antonio. And it was for an Alzheimer's study. Oh yeah, you know which one. Were you there?
No.
Oh yeah. Rami was there with me. Yeah. I got Raider certified, but I spent a lot of time business developing with other sites, more than I was interested in the study. But if you're like a new investigator or a new coordinator, you need to go to these things. First of all, you can meet other people, meet colleagues. You can learn about the process, right? Like, I think new investigators should go to these investigator meetings.
Well, I mean,
I think they should go to all of them. But
yeah, everybody. It's just like I say, you learn a lot about the study.
Yeah.
And it will make it easier during the process of working with, and also you will get to meet the face of people that you're working with in the CRA and the sponsors. So
that's pretty cool.
CROs.
So how much networking did you do?
Ooh, a lot.
Just with people at your table, or you went to everywhere?
No. The night before we did with some other people, and then
a lot of Miami sites.
We saw one table with a lot of Miami people.
We didn't know them.
So no.
Oh, really? Mm-hmm. That's another competitive place.
One of the doctors was Cuban.
Oh, okay.
A lady.
Not the one we know?
No.
Oh.
Somebody else.
How come they didn't get to study? That's weird.
No.
It's weird how they do site selection. Interesting. All right. Anything else? Any tips? Last minute advice for anyone doing an investigator meeting? What to expect? This was a very short one. Usually they're like 3 days. So this one, maybe they're trying to make them, and I'm seeing less investigator meetings. They're doing them all on the phone now, like teleconference investigator meetings.
That makes the industry is already not attractive for many people, and that makes it even less attractive.
What do you mean, like for doctors?
Yeah, because it's just like it makes it just like
they're not as engaged.
Yeah, no, and that should be. I mean, is the most important part of pharmaceutical.
Wow. Yeah, that's usually when they're longer, you can network more, and you could go out and visit the city a little bit. But it doesn't sound like you had time for that if it's just less than 24 hours that you spent in Dallas. So just one night.
Yeah.
And you had to check out prior to the meeting starting in the morning.
Yeah. Well, I check out.
Wow.
In one of the breaks, I went upstairs, check everything, and go downstairs, leave my luggage.
That's crazy. One day.
Yeah.
And there were still a lot of doctors that showed up?
A lot of doctors.
Interesting. Okay.
Yeah.
Like half of the sites had doctors, or?
I will say probably even more. I saw a lot of doctors this time, yeah.
This is a good study. I think we're lucky to have it.
I think it's quite interesting.
And we're lucky to get started on it.
Very interesting study.
Mm-hmm.
Yeah.
Good. Well, we will do another podcast later on recruitment.
And we can do one about how we went in our site initiation visit on Monday.
Oh yeah, we have a SIV on Monday. Yeah. I'm doing the slides right now on SIV for a CRO that the sponsor I'm working for with my CRO. So that's actually, I'm going to do a mini video today about that post SIV activity. SIV is a busy visit for the site.
Mm-hmm.
It's like all day.
All day.
They train, the PI needs to come, they train everyone. They're probably going to want to train me, right?
Yes.
Wow. Great.
Welcome.
Especially since I didn't go to the investigator meeting. They're going to want to train me for sure. Yeah. Okay. Well, Monday will be fun. All right, Monica. Thank you very much. Anything else?
No, that's it.
Thank you, everyone, for watching, listening, and go to your investigator meetings, people. Yeah?
Yeah.
Run into Monica. All right. Talk to y'all later. Bye-bye.
Bye.